Okay, good morning. I'm Michelle Fideli, and welcome to the Marin Communications Forum. We are here today to talk about unaffordable housing in Marin and the impacts of homelessness and precarious housing on children and families. Very happy that you could join us. We're very happy to have a panel discussion today, but we also want to invite all of you to join in the discussion. We have plenty of time for that. And we're going to begin. I want to introduce our moderator, Meredith Parnell, from the Marin Organizing Committee, and she's also the new Executive Director of Marin Kids.
Well, great, thank you. So again, my name is Meredith Parnell. I'm the new Executive Director of Marin Kids. Some of you might know me from my work at Rhoda Shalom and the MOC, but I'm really excited to be here today in this new role. What drew me to work for Marin Kids? Its mission, to ensure, and I have to look at this every time, that every child in Marin is safe, fed, housed, healthy, nurtured, and educated to her or his potential. Who doesn't want that, right? I know I'm preaching to the crowd here, but in sum, Marin Kids is dedicated to building a community that understands that caring for all of the children in Marin is our collective responsibility, and that we need to work together to put investment in children and their families at the center of our political agenda here in the county. So we're here today to focus on one aspect of the issues that are confronting families and children in Marin, which in other words means mostly all of us, which is housing. Marin Kids started talking about this issue back in 2013 with our Home for Kids initiative, and it's our intention to pick up where we left off. So, a few questions for all of you. By a show of hands, how many of you live here in Marin County? Put your hands up. Okay, everyone look around. Put them down. Of the ones who live here, how many of you rent? Now keep them up. Of the people who live outside the county, how many of you rent? So there's a fair number of renters in here. For me, it's always interesting to see. I'm a renter too. Although I grew up in Tiburon in a house that my grandfather built, one that I could never afford to buy today, I now rent a house in San Anselmo where I've lived for 13 years. I assume that my rent will be going up in November because that's customarily what happens, although my landlord could raise it at any time. By November, it will have gone up at least $1,000 over the last 13 years, and I will be paying more than 30% of my income on rent. And I know my rent is under market. I'm lucky. My landlord is a pretty nice guy and has told me that he values us as tenants. But even so, I didn't complain about my stove not working for over 2 years. We hosted my oven. We hosted Thanksgiving, but had to have someone else bring the turkey because I couldn't count on my oven to work. I have lights that don't work. I have old plumbing that takes a lot of patience, and fortunately, a pretty handy husband. But I know I can't live in that house forever. I'm hoping to stay for 2 more years until my son finishes college, and then it's possible that my luck is going to run out. So I'd like to start with a few numbers as a frame to this morning. And as housing prices are clearly through the roof, we're really going to focus on renters. Marin's population is approximately 260,000 people. 36% are renters, or 95,000 people. We're in good company. Over 30% of these renters are not white. Average rent for a 2-bedroom apartment in Marin in 2011, $1,815. Average rent for a 2-bedroom apartment in Marin in 2017, $3,074. That's paying over $36,000 a year just in rent. Housing affordability is often defined by what percentage of your income you're paying for your housing. The gold standard is that you should pay no more than 30%. In Marin, that would mean that your family's income would have to be approximately $120,000 a year. In reality, more than half of Marin's renters are paying over 30% towards their housing. And when that's true, families have less money to spend on other crucial necessities like food and health care. Marin's added over 15,000 jobs since 2010. But what kind of jobs? Major areas for job growth are relatively low wage. That's in the hotel business, restaurants, bars, other tourism categories. I learned on Saturday at the San Geronimo Valley Affordable Housing Association workshop. Shout out to Suzanne Sadowski for such a great one. Lily Thomas presented, and she said in the last 2 years, 70% of Marin County hires live outside the county. 70% of people working for our county can't live here. And the other thing I would talk about is homeless children. Last January's point in time count counted 124 children under 18 experiencing homelessness, either in a shelter or on the street. But we know that that's a really low number and that many people go uncounted. We also know that the point in time count uses a different definition of homelessness than do schools or healthcare professionals, I'm sure we're going to hear about, and therefore leaves out all the families who are in shared housing situations, where families have worked really, really hard to put a roof over their kids' heads, but that means that they're living on someone else's lease. In fact, here in Assembly District 10, the official number of children experiencing homelessness, at least in 2014, was over 1,600 kids. I'm sure Lisa's going to have something to say about that. At any rate, I think we can all agree that we have a crisis on our hands. We're going to learn today about how deep that crisis is. Could be a little painful. Some of the factors that have led to it. Hear about some services that are already being offered, and start to think together about how we might collectively build a political strategy around doing something about this. So we've got 3 fabulous panelists here today. I want to introduce each of them. We have Debbie LaRue from the Marin County Community Development Agency, Dr. Lisa Levitt from Marin Community Clinics, who's also a First 5 commissioner, and Lisa Schwartz from the Marin County Office of Education. And so I thought I would just start with you, Debbie, just to give a little spiel about where you are in all this.
Wonderful. Can everyone hear me? Okay, well, good morning. As Meredith said, I'm Debbie LaRue. I work with the Marin County Community Development Agency in a tiny division called Housing and Federal Grants. As a planner, I work with policies, regulations, and programs, and do whatever I can to support the development and preservation of affordable housing in the county. Now, affordable housing and housing is a broad and complex subject, so rather than regale you with a full description of everything that I do on a daily basis, I'd like to summarize a couple larger work programs that we are in the process of implementing, including a just cause for evictions and mandatory mediation programs. The county is also reevaluating or evaluating the possibility of creating short-term rental regulations. Hopefully next year we'll be evaluating multifamily land use designations, and we'll also be considering a reevaluation of the housing overlay designation policy. Now that's all very government wonkish, and I apologize for that. I'm just highlighting those in case somebody here does have questions about that. Other than that, I would say that the county understands that zip code determines not only your health and education outcomes, but also your employment outcomes. And we are dedicated to developing housing in areas of opportunity.
Excellent.
Thank you.
Dr. Levitt.
So first of all, I want to thank Marin First 5 for the opportunity to speak today on behalf of Marin's children and families, and also allowing me to participate in this really important conversation. And so my confessions are, number one is that I'm really nervous because I am not a public speaker. And so I appreciate that you are a very...
It's a nice crowd. These
very
are friends,
forgiving
okay?
audience.
We're preaching to people who care about this.
Which is also another reason that I'm nervous, is because when I look at this audience, I think, wow, these folks have so much more direct experience with today's topic, and I'm really glad that we are going to have time for audience participation, because I always look at these opportunities as a real chance for me to learn from you. So I also had sort of 2 fears when I was preparing for this talk, and one of them was, what do I have to add that you don't already know? And the other was how not to make this too depressing, because I know that I have data, I have some stories, and they're not particularly happy. And I don't want to leave us on a note of sort of gloom and doom, but we do know what interventions work, and we also know that kids and families are resilient. So my name is Lisa Levitt. I'm a pediatrician at Marin Community Clinics, and I've had the honor of taking care of children at Marin Community Clinics for the past 21 years. Wow. I started working at the clinic straight out of residency at UCSF, and Marin Community Clinics still has me. They have not kicked me out yet. But before I kind of go any further, I really want to give a shout out to Hannah Bickoff, and
Here.
who wanted to be here with us today, but couldn't be with us here today because she is in class today as a full-time student at UC Berkeley, earning her master's in social work. So many of you know Hannah and have had the opportunity to work with her. But I'm channeling Hannah today because I really credit Hannah with starting a program at the Marin Community Clinics, our patient care navigation program that I'll be talking about a little bit more later. But many of you know about Marin Community Clinics, but just in case, and I did have to look this up on the website, not because I don't know what Marin Community Clinics does, but because I really enjoy looking at the website. First of all, because it's a really amazing website, and I always learn something when I actually go on there myself and look at it. So I encourage you all, if you have a few free minutes to take a look at it, because at least for me, it's a real testament to sort of where the clinics has come, certainly over the past 21 years that I've worked there. But Marin Community Clinics is a multi-clinic network with a wide array of primary care, specialty, and referral services. As a federally qualified health center, we provide vital health services to more than 35,000 patients annually. MCC is a key healthcare safety net for Marin County's low-income population. 80% of our patients are Medi-Cal enrollees, and 40% are children. MCC has been around for 43 years, now consists of 9 clinics at 6 sites. We have a staff of over 380 employees. I'm also, as Meredith mentioned, a member of the Marin First 5 Commission for the past 5 years, and this year I'm serving as the board chair. And my newest hat is also serving as a board member for Marin Kids. So let's talk about social determinants of health. The Marin Community Clinic has long known that supporting patients outside of the exam room is critical to their health and well-being. We all know that social and economic issues have a direct impact on the physical and mental health. To learn more about how to better serve our patients at MCC, we conducted a patient survey last year. And guess what was identified as the greatest social support need? Housing. Followed by legal assistance and transportation. So let's talk about housing as a healthcare investment. Child health and housing security are closely intertwined. Children without homes are more likely to suffer from chronic disease, hunger, and malnutrition. Homeless children and youth often have significant psychosocial and developmental issues. Dr. Megan Sandel is a pediatrician, and she promotes the concept of a stable and affordable home as a quote-unquote vaccine to keep kids healthy.
I like that.
She says housing insecurity is just the part of the iceberg that we can see. We know there is a lot more under the surface, forcing families to choose between rent, food, heat, or medicine. Dr. Sandel recently published a study in March 2016. She found that homelessness and unaffordable or unstable housing has a harmful impact on the health of children. No surprise. And that the negative health outcomes are compounded when a mother is homeless both before and after her child is born. Children who experience both pre- and postnatal homelessness were 41% more likely to have been hospitalized since their birth. More hospitalizations, of course, leads to higher health care costs, and a large share of those costs are paid for by publicly funded health insurance. The study also found that affordable housing reduces infant hospitalizations. Infants in food-insecure families with rental assistance during the prenatal period were 43% less likely to have been hospitalized. The lower hospitalization rates were due to better overall health and fewer instances of severe illness. Dr. Sandel's study was published by Children's Health Watch. And just because I wasn't aware sort of the work that Children's Health Watch does, Children's Health Watch is a network of pediatricians, public health researchers, and children's health and policy experts. They're committed to improving children's health in America by collecting data in urban hospitals across the country on infant and toddlers from families facing economic hardship. The data helps policymakers and the public better understand the social and economic factors that impact children's health. According to an article by the American Academy of Pediatrics last month, adequate housing provides more than just shelter. It supports a safe and stable environment for children to live and play. Many families are unable to find a stable and affordable place to live, leading to frequent moves, overcrowding, unsafe living conditions, and homelessness. Housing insecurity is associated with increased risk for chronic disease, poor nutrition, developmental delays. Substandard housing can expose children to safety risks, as we know, including lead, mold, fire, and other injuries. The AAP recommends that pediatricians seek to identify housing insecurity and homelessness in their pediatric practices. To improve children's long-term health, it is necessary to look beyond the clinic walls into the community where children live, learn, and play. Pediatricians have regular contact and long-term relationships with families and are positioned to identify problems and link children and families to much-needed resources. So how do we ask about housing insecurity in a sensitive and non-judgmental way? One pediatrician at a community health center in Philadelphia asked 2 questions that she finds helpful. Number 1, who lives with you? And number 2, are all family members sleeping well? Which gets at a number of issues. Other needs may be revealed when discussing a family's housing situation. Other things such as unemployment, intimate partner violence, and substance abuse are all issues that can lead to housing insecurity and homelessness. So what are some of the known health effects of homelessness on children? Again, this is something that you don't already know, but higher rates of acute and chronic health problems, including ear infections, diarrhea, bronchitis, dermatologic disease, increased asthma, both rates and asthma severity, more accidents and injuries. Homeless children are more likely to skip meals, worry about the availability of food, consume foods with low nutritional quality and high fat content, leading to high rates of malnutrition, stunting, and obesity. There's an increased risk of abuse, exposure to violence, and psychological trauma, higher levels of emotional distress, especially anxiety, and developmental delays, including speech and language deficits. So the list is fairly
That's depressing.
depressing.
Yes.
So
Let's just say it, that's really
it's
painful
really
to hear.
painful, I know.
But
and
it's
I have to
real,
say, in
it's
my
real,
own
but it's
experience, from when I started until now, just the number of children that I'm seeing with anxiety has just, it's pretty through the roof.
So you've really noticed a change in your 21 years?
Yeah.
Yeah.
So we know living in survival mode is stressful, and a stressful family environment affects the health of the child. We also know that effective interventions can buffer the effects of poverty. Things like promoting strong family relationships, providing health care, early childhood education, affordable housing, home visiting programs, nutrition support programs. The good news is that supports and interventions can cause positive changes in a body's stress response and also in the architecture of the developing brain. So some strategies that have been found to be effective in pediatric offices are facilitating Medi-Cal enrollment at the clinic, updating immunizations at all visits rather than scheduling an additional visit, routine screening to identify homelessness and housing insecurity, as well as other risk factors, developing care plans, acknowledging that barriers exist, and offering options for transportation vouchers, more flexible office hours, prescribing the most affordable treatments available. So another example of one of our successes at Marin Community Clinic has been our patient care navigation program. So in the first 6 months of the program, some of you are probably familiar with this model. It started out in hospitals. But imagine yourself finding your way around a complex US healthcare environment if you don't speak English, if you come from a different culture, if you can't read or write. Imagine that you are homeless, can't afford to buy food, don't have transportation, or are worried about your immigration status. Getting health care may certainly not be your first top priority, and knowing how to navigate the system can be daunting. Our MCC Patient Navigator provides hands-on guidance to help patients access community resources so that their broader life challenges can be addressed. Because we know that if their basic needs aren't met, they are less likely to be healthy. Our bilingual navigators see patients who are referred by the medical providers and you, our community partners. Navigators meet with each patient to assess their needs, and navigators can accompany patients to interviews with Social Security, housing programs, immigration authorities. Also reach out to local charities to donate items such as rental assistance and furniture. The work requires perseverance, strong advocacy, and lots of paperwork. The work is intense and time-consuming, and it's the work that you all are doing as well. It's often, as you know, complex social situations with a very strong emotional component. I do have some case studies that we can talk about now or later, but there are also stories that our case navigators have worked with directly.
I'm sure we'll have a chance.
Yeah.
And I have some questions for you to follow up, but I want to hear about the schools and the school's point of view about what you know.
Hello, everyone. My name's Lisa Schwartz. I'm a director at the County Office of Education. I'm here representing Superintendent of Schools, Mary Jane Burke, and I'm thankful that I see so many friendly faces and colleagues at almost every table. I started as an intern at the County Office of Education 36 years ago. And over that time, I've worked as a school psychologist. I've supervised our school psychologists. But for the biggest part of my career, I've worked with students in alternative education, children that are in our juvenile hall and juvenile justice system, students that have been expelled, and so on. And then I have had the, I consider, great gift of being allowed to work in what we call our safe schools and prevention programs, which have included working with the homeless education grant when our county has had one. So I have a variety of touch points with children and students in this topic. And I want to give you some data first. The way education identifies a child who is homeless is different from other entities. So our definition of homeless is a child who lacks fixed, regular, and adequate nighttime residence. So kids in motels, hotels, shelters, kids living in a car, that's kind of obvious. Children living in a trailer park might not be as obvious. Children who are living doubled up and tripled up in houses or apartments are included in our count. And in Marin, we didn't really start carefully training and trying to get a number of our homeless children and youth until about 2007. So the count we had in 2006 was less than 400 homeless kids. As soon as we started really doing a good job training our school staff, that leapt the very next year to 1,093. Our highest count so far has been in the years 2010-11 and 2011-12, when we had 1,438, 1,432. So, and those are just the families that said yes or identified. We have to acknowledge that many people do not want to be perceived as homeless or as having chronically unstable residency. So we have a lot of children in this circumstance. And I thought that I would just ask you to do a little mental task. So I don't know how many of you are introverts and extroverts, but kind of identify yourself. Are you the gregarious Mary Jane Burke type who's going to walk up and shake anybody's hand and say hello and be very cheerful? Or are you more like the Lisa Schwartz type who would stand in the back of the room and not want anybody to really notice you? And picture it's your first day of school. And you've never been to that school before. You're a kindergartner, and boy, if your mommy wasn't there holding your hand, that could be just terrifying. So stress-inducing. Even no matter how welcoming that kindergarten teacher is or that preschool teacher is, for some of us, just naturally, that's a scary experience. And then picture that you have to go to a different school 3 times in a school year. Have to change a school every year or 2. It happens to our kids. And it's a great challenge. I want to say that we are a very fortunate county. We have amazing programs. We have amazing early childhood education. We have wonderful programs in our elementary, middle, and high schools where we're teaching young people to be inclusive, to welcome everyone in their classroom. However, kids who are homeless are often on the periphery, often on the outside. And even if they're not, picture that you're living in a 2-bedroom apartment and there are 11 people there. They're all family members. There's 11 people in a 2-bedroom apartment. Where do you do your homework? If you're a high school student in a Marin County high school, you're expected to do 2-3 hours of homework a night. And how do you do that in that setting? No matter how wonderful and caring and supportive your family is, that can be a tremendous challenge. The data, before I go to the data pieces, sorry, one of our experiences in alternative education is we will meet a child who's 12, 13, 14, and my team and I will say, gee, this kid looks like he or she really might have some special learning needs. You know, it's obvious that the child has a learning disability or an emotional disorder. And when we find the school records, which can be very difficult to do for a child who has moved from school to school to school to school, but when we find them, we will find notations of schools saying the same thing we did. Boy, this child looks like he or she needs more help. But before the systems move and get rolling in terms of how we do eligibility, the child's gone. again, through it's not parents refusing, it's not denial, it's literally the amount of time that our processes take to catch up to a child. And then we will see, I'm pointing to Karen Allen because she was our principal through this past year, we will see kids who are struggling academically and clearly have those issues and have not stayed in one place long enough to be identified and have service delivered. There's a lot of data out there, and it boils down to even one episode of homelessness from early childhood through high school will impact a child's academic achievement. In one study where they were looking just at the elementary school level, they looked at academic achievement of children who were in stable housing and children who were in not stable housing in the same classroom. And they found that the kids who were not in stably housed settings, 75% of those kids were below grade level in reading. Reading's critical. 54% of those students were below grade level in math. And I don't think we have to dig very far to see why that would be the case. Students in these situations are twice as likely as and I'm talking all grade levels, to be held back. So you've missed so much school because you've moved from one place to another and there's gaps before you get to enroll in your next school. They're twice as likely to be held back a grade. And this is my personal opinion based on years of observation, holding a child back a grade is almost putting a sign on their door that they're going to drop out of high school later. For sure. Not always, but that's what I've seen in my career. These children are twice as likely to be expelled, and they are twice as likely to drop out of high school. So we have a lot of reason to focus on this issue for our kids. I wanted to also talk about our pregnant and parenting teens. A colleague of mine, Teresa Ashby, has a little grassroots group that she's had for over a decade called Young Moms Marin. And this is voluntary, and it's young women and young men who have children. And at any given time, in that group of about 10 young people, 10 or 15, half of them will be homeless. Mm-hmm. Half of them are homeless, and they have babies and little children. In one example, when I was still directly responsible for our homeless education services, one of our moms who had mental health issues of her own and needed mental health support, and those issues interfered with her ability to access and follow through for herself, had a second grader, a kindergartner, and an infant. They were sleeping in a bus station, and Young Moms Marin was trying to, number one, get them housing, but number two, just help her get the children to the schools that they needed to get to. So the issue of transportation directly connected to that young woman's experience. And then beyond our kids, I want to go back to the issue of renting.
We're going to go back to the issue of renting, but
Yes.
yes, please, go ahead.
Our educators who are taking care of these children aren't able to live in Marin County. And for all the reasons that you've identified, so we have teachers commuting from the East Bay, we have teachers commuting from the North Bay. They have their own children to take care of, so they've got, instead of being able to stay after school and do a tutorial or have a parent meeting, they've got to get in their car, or hopefully the smart train, and get, get to their own families. And our superintendent is working with the education leaders in Marin, our school board members, our representatives from the cities and the county officials to actually look at more affordable housing for service providers, including teachers and school support staff. And I hope that in the next 30 years, that we will actually see the majority of our education staff live in Marin and be able to become a close-knit part of our school communities rather than commuters. So,
Great, wow, that was really overwhelming, wasn't it?
sorry.
No, all of that. Thank you. That's a lot of expertise. It's really fabulous. The things that I was hearing, well, there's a couple things, and this really kind of goes to sort of the clinics and sort of the medical healthcare view and the school view, is that obviously there's a tension between respecting people's privacy about the circumstances of their lives, and like I said before, I mean, there are plenty of people who get technically defined as homeless who don't think of themselves as homeless. They're working really hard to put the roof that they have over their kids' heads. So part of the problem, though, is this identification, because you talk in the clinic about you can ask these great questions, but I mean, how great are the clinic's resources? So when you've identified this person as having this housing instability issue, and then like one of your studies casually cites, and then you could offer them all these services. It's like, I'm sure you're a fabulous pediatrician, but you probably don't just have a whole list of services, and you're not really in the business of doing that kind of counseling. And as fabulous as your parent navigation center, your patient navigation center sounds, it's almost, we also don't have as many services as we'd like to be able to offer, let alone mechanisms. So I see there's a couple of different, there's some questions around data collection. How can you truly identify people in a way that doesn't stigmatize them, but allows them to ask for services? And some of that seems like it's not going to happen in an office, it's not going to happen in a survey or on a form or even at school, no matter how well you're trained. Mm-hmm. So there's a sense of, like, is there a way to do more sort of home visits? I think I asked you the other day, whenever does the clinic or do healthcare professionals generally do home visits? And what did you tell me?
So the one opportunity that I have to order a home visit for a family is right after a baby is born. So that is the one small window where
and that's
a nurse can get into that home for one visit. And again, the focus is very much on supporting a mother with her brand new baby infant, and very focused on that one issue.
Which is tremendous and needed, but there are not many other opportunities for that. So some of this is around data collection and how we identify people, but the other issue is around the services that we can actually offer. It's easy to talk about rental assistance, but there's not a ton of money for that. So I kind of do want to go back a little bit to the renter stuff, and I'm going to come back to you about that, Debbie, because in a lot of ways, that's really the crux of the problem, that there's, it's a supply and demand problem. You can talk to that in terms of what housing stock's available, how many Section 8 vouchers are actually available, where the money is, and what kind of renter protections are possible, and what would it look like to kind of get people thinking about that, not just people, but like the health of our families and our children in that context.
That's a big question.
It's a big issue. I'm not saying you have to solve it, but.
Okay, all right. So we have a limited supply of housing in the county. Our vacancy rate is very low. And
when you say very low, what's very low?
It's like less than 5%.
Less than 5%?
It renders the market largely ineffective, right? They say you have to have at least above 5% vacancy just to allow for a little bit of shifting in people's home movement patterns. So say that you're leaving your apartment voluntarily and you know 60 days in advance that you need to find a new unit. When you have less than 5% vacancy, the chances of you being able to find a unit, even when there's plenty of housing stock, are slim. Or maybe you'll be able to find it within 60 days, but you're going to be sweating it for at least 6 of those weeks. So that's one issue in terms of how much housing we have, and also the vacancy rate. Now, one way that we can give our renters a little bit more stability in the county is to provide some what are called tenant protections, right? So just this past year, we created a source of income protection ordinance that said that if you have a Section 8 voucher or some sort of other third-party rental subsidy, that landlords weren't able to discriminate against your application. Now that's great. Now that can help somebody get in the apartment, and the Housing Authority, I'm sure, could speak to the increased success rates that we've seen since the establishment of that program. But then once you're there, how do you stay in the unit? Now the board is considering something called, will consider something called just cause for evictions. We brought the idea back to the board on August 1st, and they have said that they would like to see it. Now a just cause for evictions ordinance would provide stability in that a tenant or a household and someone with children who is living in a school district or working somewhere would know that unless they gave their landlord good cause, they wouldn't just get evicted. Now, the landlord would still be able to raise their rents. If they do anything, if they violate their lease, they could still be evicted, but this would essentially stop the landlord from deciding out of the blue that they didn't like that a tenant had another child living in the house, that they were pregnant, they were concerned about the noise, and to kick them out in the middle of the school year. I'm going to have you break down the question.
I was going to say, and we've heard those stories about people who, I heard a story about a mom who was pregnant, who when she told her landlord she was pregnant, she got an eviction notice. Mm-hmm. No questions asked, like, doesn't matter how great she was.
Right, which isn't legal. However, since there is no provision that says that a landlord must have just cause, they are allowed to sort of de facto evict this person for a privately held reason that they don't want a pregnant woman living in their house with no legal repercussions.
So you want to talk about mandatory mediation? Because that's another thing you mentioned.
Sure. So over the past couple of years, there have been a lot of conversations with tenants, with the landlord community. The Housing Authority has actually spearheaded a lot of these conversations. And when we're sitting in these rooms discussing, well, you know, we have this affordable housing problem, we have instability for renters, what can we do about it? There's this general understanding that the folks that are sitting in the room, they typically call themselves mom and pop landlords or good landlords, are not the ones jacking up rents unreasonably or quickly. They're always happy to sit down with their tenants when there is an issue, right? And Meredith's, you know,
My
case,
landlord's like that.
right, she can have a conversation with her landlord and say, you know, my son's in college. Can this wait a couple years? Right? So there's this idea that if you can get a landlord and a tenant to sit down and across the table and say, the landlord can present his case and say, you know, I am noticing that I have an increase in my service costs, right? It costs more to collect my trash. There's some capital improvements that need to be made for the apartment. This is why I'm raising your rent. And the tenant can say, this is my financial situation. These are my constraints. May I have more time before you raise the rent? Is it possible for you to give me a slightly, you know, decreased increase? Maybe only raise my rent 3% versus 5%. If we have that opportunity for our community to have those conversations across what two groups are typically considered sides of an issue, right? This conversation is typically framed as landlords versus tenants. If we can bring them together to have a constructive conversation, we hope that we might see perhaps reduced increases, or at least foster some goodwill and greater stability for tenants. So the board heard a very bird's eye perspective, an argument for us considering a mandatory mediation program in the county on August 1st of this year. We had that board hearing. And they've asked that the staff can continue to work with other jurisdictions and work with experts to put together a proposal for establishing a mandatory mediation program in the county. Tentatively, this would mean that, you know, if a landlord increased rents more than 5%, that that the landlord or the tenant could request that they come together and sit across the table and have a constructive conversation about that increase. Now, a mandatory mediation program could also be structured in such a way that we could get some better data on the increases that we're seeing throughout the county. So we have this, good policy is always informed by good data, right? Now, we have some great resources in the county for getting some of that qualitative narrative, right? We have MOC, PSP, and we have folks who are bringing together these stories that say, this is how the rental housing market is impacting me, these are the increases that I'm seeing, this is how it's impacting my children and their education and our health. And they can piece together some of the compounding intersections that reside between housing, health, education, and opportunity. However, we lack sort of this quantitative data, right? So there was one company that was producing some metrics every quarter that was polling units with, or apartment complexes with more than 40 units on site and sort of churning out this aggregate data that said, these are the rent increases that we're seeing. This was the data that a lot of folks were using to sort of gauge the rental market, and they were doing because it was a little bit more timely, right? It was done on a quarterly basis. Outside of that, and they are no longer in business, so we don't even have access to that. Outside of that, our best data source is really the census data, right? So the American Community Survey, and please, I apologize that I'm talking about census data on a Monday morning. I will keep this part brief.
Get some more coffee.
Right? Yeah, everybody get coffee now. I'll keep going. Our census data has improved in the recent couple decades because it's no longer this decennial set. It's collected regularly on a rolling basis. So we get these reports every single year that come out that will give us some information on our rental increases, on how many people are living in a household, how many people on average are living in each room in a household. And it breaks it down in all these wonderful ways. But the best census data is that taken in 5-year snapshots, right? Because you need to have a large sample to make sure that it's accurate. And our housing market is changing so rapidly that a 5-year sample, right? It's just not accurate and timely and precise enough for us. So it's really important that we start getting better data to understand exactly how the market is behaving and what the ramifications are for low-income households, right? And to break it down one more step, if we only have one data source that says these are the increases in rental trends, that's fine. And it's helpful to know that information as a sort of benchmark. But that doesn't tell us how the market is behaving for low-income units versus market rate units or luxury units, right? You might tell me, oh gosh, the market's really cooling down. It's only, we've only seen a 6% increase, which is incredibly high, by the way. A 6% increase in the past year as opposed to 10 the year before. Okay, great for you. I'm happy that you gave me that argument. Does that mean that the luxury units only saw a 6% increase and the low-income units saw a 6% increase? Or are the affordable units seeing a 20% increase and people have decided that luxury units are less attractive? Right? We have to be able to break down our data in such a way that we're actually able to understand the impacts on our community members and not just those folks buying second homes. To bring it back to mandatory mediation, it would theoretically be possible for us to start requesting that landlords or tenants, most likely landlords, would start feeding us information about what increases they are applying to their tenants. And I think that could be very helpful for us crafting policy moving forward.
Well, it sounds theoretically possible, since there used to be a company that collected data every quarter, that could actually be done again with the right amount of funding. I mean, instead of just relying on this ordinance that was under discussion and who knows what's going to happen and how you would design it, it sounds like we have had a more robust system for collecting data in the past, and that is possible to do again. It just, like everything else, might take some money. I mean, what I sometimes hear from people is like, and we can talk about this a little bit, that just cause eviction won't stop your rent from going up, and it won't necessarily stop you from eventually having to move, and mandatory mediation isn't binding. But in this county, there doesn't seem to be any sense that the tenants have any rights whatsoever. So I think it's possible, just moving along the lines of, it's to try and begin to create some sort of fairness in this. And let's also be clear that this is an issue of all renters across the board, whether people are renting at sort of luxury rates or very low income, that all renters, so this is a broad sort of problem, which is also something we need to demonstrate. But that there might be some solutions around, for funding, just around, or for data collection, just sort of organizing the funding for it. So, I mean, there's some real possibility there, to me, it seems like. I want to talk a little bit about the overcrowding thing, though, because what is really also painful is that, obviously, if you've got extra people living in your house, in order to be able to make rent, you violated the terms of your lease, most likely. So those kinds, just cause eviction isn't going to protect people in that situation, nor is it going to roll back the high rents that we already have.
Right.
So that idea of overcrowding and how to get at that and what are the possible, I know I'm watching you scribble furiously.
I'm writing down, I'm making notes here.
Okay.
I'm just saying, okay, how do we get rid of that?
Yeah. But I wonder, we might not be able to do everything all at once, but I think we need to shift the conversation and sort of shift some of the power balance in here from the landlord, especially the big landlords, the big kind of corporate landlords. I don't know about you guys, but as this county gets older, I mean, I've seen it in my neighborhood in San Anselmo, adult children who haven't been able to afford to live in Marin, who therefore don't have any real attachment to the community, their parents pass away, and they're just interested in getting market rate for their house. Understandably, there's not any of that connection. That's true with multi-unit buildings. I think that was true. I think personally with the Red Hill Shopping Center, that's sort of what happened. I mean, we're seeing that more and more. And so, one of the things I'd like to just be thinking about is how do you kind of get at that? Is there anything you want to say about what resources that I mean, when you get answers to those questions, you gave 2 good questions about how you identify people. And when they say stuff, what's your step after that?
Well, I think just the fact that you're asking the question is important to sort of validate that these questions are important to your child's health. And even though I may not have all the answers for you, I'm willing to enter into that discussion because I think for so many years, I mean, the medical model is, I will diagnose your ear infection, I will treat you with an antibiotic, and, at least for me in my own career, I've realized that part of my job is still satisfying. It's still very satisfying to treat an ear infection, I have to admit. But for me, what's more satisfying is actually to get to know this family over time, to go with them on the journey through all their ups and downs, and to be a trusted person that they can rely on, just to listen. Even though I don't have maybe all the solutions, I can refer them to our patient navigator. I know people to call. Am I going to be able to solve their problem? No. Or maybe a very small part of the problem, but at least acknowledging that this is stressful, that there is anxiety that everybody's dealing with, that the children are the barometer for the parents' anxiety,
Right.
That they're absorbing all, the stress in that home environment and how that's impacting, that child's health and well-being and their educational success. I think it's been interesting for me to see over time how anxiety really affects kids' ability to do well in school, and how these children sometimes do get misidentified as having a learning issue, an attention issue, when really what's going on is that they're not sleeping well at night. The TV's on, there's too many people, it's crowded, they're sharing a bed. And it's really impacting their sleep. So when you get down a few layers to really sort of reveal what are, the root causes, I think that's what I find, at least at this point in my career, the most challenging, but also the most rewarding.
Well, the schools have the kids even more often. I mean, you see, obviously, over time, you have relationships, but you got the kids every day.
We do. Well, we want to.
Right? That's the plan.
What I wanted to touch back on is the question of how we know how many of our students and which of our students are being affected by homelessness or chronic instability. And number one, we need to stop being afraid of asking the question. So that goes back to the idea of regular training of the staff who get the registration information, that this is not punitive or critical. And I think we still have people who are afraid to ask the question, number one. Number two, families who understand that we are trustworthy and we are not going to use that information to harm them in some way is critical. Trustee Jackson from the San Rafael School District is here, and those numbers that I quoted you earlier, San Rafael was the first district to really get a better grasp on how many kids were living in homeless situations by our definition, and that had to do with staff. That had to do with staff who had a relationship with the community, who did go out and do home visits. We need bicultural, bilingual people in these positions, and we need to be able to make sure that our immigrant families feel safe enough to say, yes, this is my circumstance, without thinking that it's going to get them kicked out of their dwelling, or that somehow immigration authorities are going to be notified. That happens with time and trust. So I think those are, I really do think our numbers are an underestimate.
Yes.
And if we don't know what the data is, then how do we go forward with the kinds of changes that Deborah was talking about? So.
Absolutely. So, questions. I know we got a lot of expertise in the room. Now's the time to ask them.
Thank you. A lot of wisdom here, a lot of information. I wanted to ask,
Get your mic a little closer to your mouth.
is this close enough? Is
Good.
it registering? Okay. I'm kind of solution-oriented. I think we have a lot of data. I think we know a lot about the problem and the impact of homelessness or housing instability on families. We see it every day in where we work and where we live. I was very interested in knowing a little bit more about some of the things that Debbie mentioned having to do with possible changes in land use regulations that will allow for maybe an increase in the housing stock, and what you see as the possible impact in our county of the new legislation that is coming down from the state, and how will that help to alleviate some of the problems that we're facing here in our communities.
So is this referring to the multifamily zoning guidelines?
I'm sorry?
Is this in regard, when you're asking questions about land use and zoning?
Yeah.
And changing those?
I don't understand completely about how that, how is that supposed to be implemented in our communities. I know out where I live in West Marin, there's an awful lot of land that's very well protected and should be. But is there some possibility that there would be an easing of some of the local restrictions that have kept us from taking small incremental steps rather than large developments, which would not be possible in our communities? And the other thing I'm really interested in, also impacting our communities in West Marin, specifically the coastal communities, are this proposed increase in taxation for short-term rentals, and how will those fundings be used to increase housing in the communities? I know the coastal communities have a lot of people who are homes that were second units or full-time rentals are now being hotel rooms for short-term rentals. Same thing in the valley, to a lesser extent, but increasingly so as people come to Spirit Rock and want a place to live so that they can attend a seminar. So these are some of the things that are eroding what we already had as existing housing in our communities.
Okay, so that's a large question again.
Okay.
Brent, don't go too far on the
You can
stage.
answer a piece of it, because there's some other questions.
Okay, all right. So the evaluation of the multifamily land use designations, that wonky thing I said earlier, is a project that we'll most likely begin working on the beginning of next year. As many of you are probably aware, Marin is largely zoned for single-family residential development. It is historically, in a lot of different areas, that is a fair housing concern, right? There's whole literature about exclusionary zoning policies, and having a lot of single-family housing or zoning exclusively for single-family housing is a red flag for that issue. So we will be reviewing all of our sites that are zoned for multifamily housing to make sure that they are buildable and developable. We'll be making sure that they aren't constrained by, 100-foot stream buffer. We'll make sure that they are not in the upland and green belt areas of the county, which makes it more difficult to develop. And we just want to make sure that we don't have a lot of multifamily housing in the county. We want to make sure that our policies are not getting in the way of that. Now, fortunately for you, and also unfortunately for you, you live in the coastal zone, so you are subject to the rulings of the Coastal Commission, which makes it difficult for us to act quickly in your area. There has been a lot of county conversation about encouraging the development of what are now called accessory dwelling units. Staff likes to call them ADUs, or junior accessory dwelling units, JDUs. These might also be called in-law units, or colloquially, but perhaps less politically correct, granny units. This allows us to sort of double up the number of families that are living on a certain parcel. It can create better economic stability for the homeowners out there if they're looking for an additional source of income. The largest barrier, I would say, to creating ADUs out there are our septic standards. Right now, if you need to increase your septic load, you automatically are triggered for a coastal permit, which is an onerous process. I'm not jealous of anyone who's ever had to go through it. Now, the county staff, with the help of Supervisor Spadoni's office and Supervisor Arnold, are on that housing subcommittee, are looking at ways to sort of ease that barrier. So, we're discussing the possibility of testing septic, instead of just saying if you are automatically developing a second unit that you then have to upgrade your system, that we would go and test and see what its capacity is, and perhaps we could ease that requirement a little bit. One issue that we are seeing with accessory dwelling units, I'm working on analyzing a survey right now that we do every couple of years to sort of gauge how affordable they are. What I'm finding is that accessory dwelling units are increasingly being rented to family members or personal friends, which is great, right? Like that's wonderful, that's community stability, and those folks are often receiving a discount. What is concerning about that is that Marin has not been able to desegregate in a lot of ways, and we are a predominantly white community, and we are highly segregated. This means that your family members and your friends are much more likely to be of your race. So if we are developing second units, and we are promoting that as the only development opportunity for creating more housing affordability in the county, we need to be really conscious that we aren't perpetuating racial segregation in the county.
That's pretty clear.
Okay, I'll touch on short-term rentals and then I'll
Yep.
cut it, okay. So the current planning department, it's a separate division, took up the reins on the short-term rental regulations conversation. They worked with a consultant, Lisa Wise, to start developing some possibilities of how we could address that issue from a couple different perspectives. There are a lot of communities doing regulating short-term rentals in all sorts of different ways for all sorts of different reasons. I am not working with the group please Lorenzo, it's Supervisor Rodoni and Sears are on the housing subcommittee. We love subcommittees. Are on the housing subcommittee to look at the short-term rental regulations. I was at the hearing a few months ago in which many members of the West Marin community came out and expressed their concern that a lot of their available rental housing stock is being taken off of the market, that the families who are living there are being kicked out, and these homes are now being used as short-term rentals. I think that the board heard that clearly, and I am looking forward to seeing what's coming out of that housing subcommittee in the coming months.
Great.
Okay, thank you. I'm really glad that you're doing this. I think it's a very important topic. My name is Oshala Diana Marcus. I grew up here in Marin County. My grandparents came out during the Marin shipyards. We lived in Marin City. What I'm seeing happening now, I was raised in public housing. So public housing is designed for the next generation to get out and be able to thrive in the market economy. So what I see happening now in my community in Marin City is that at a time when other people that lived in Marin City weren't able to really rent in Marin and go anywhere else, now this community of Marin City is being gentrified. And so we're in a situation where, okay, now we've developed multi-generational connections with families in the community, and now the community is under threat because of the Marin economy and because of the market rate economy. My rent in San Rafael went up $900 in 3 years. Yep. So it's for me, this is such a bigger issue. It goes to the issue of education. Are we being prepared as we come out of, whether we're being raised in public housing or any housing, to come into an economy that is a monoculture? Marin has always been monoculture and very segregated. But the issue of segregation is now becoming way more class segregation. Right. So you can afford, if you can afford to buy, you're making, $10,000, $20,000 a month, you can afford to live here. So many of us that have grown up here, and because I grew up here, I went to Redwood. I grew up in Marin City, but I went to Redwood. So a lot of my friends across cultures were different classes. So my friends across the board are not able to live here in this county. So I think the issue really goes to what kind of place do we want to live in? Do we want this, I was kind of raised to feel like Marin was kind of a liberal, progressive place. It's not. It is not. And it actually feels very hostile because it's just a hostile environment, class-wise, where now I'm walking around and people will wonder, well, she must live here, or where did she come from? She must live in Oakland, because people can't afford to live here. And that is what our children, talking about the Office of Education, are we being prepared when we go into these programs that say 10,000 degrees, where you come out and get a degree, what are you going to do with the degree if you can't afford to live in the place that you've been living in? So yeah, we're going to have more people coming into the mental health system because it's a crisis, and it's not just in Marin. So those of us that have had to move to Oakland or Richmond, the same thing is happening everywhere. So people who grew up, my mother made the sacrifice to live in public housing so her children could have a better life. And now the children are not able to have a better life because of the direction that we're going. So I'm glad that we're having this, as I began. And I also think that I would like this connected to a much larger issue of economics, a political agenda of really what kind of state and nation are we going in? Student loans, many of us that went to school and got that education that is supposed to help us live in the houses that we would like to live in, have the degrees, but we're paying student loans.
You're right.
This is a crisis, and the
You're
thing is,
absolutely right.
and what I see in the East Bay in San Francisco, and I know many of you have gone to the East Bay in the San Francisco, we don't see it in Marin. Maybe it's a little more undercover, but people are living in tents. You know, people are living in their, I know lots of people in this county who live in their cars.
Absolutely.
They live in their cars, they eat at the same cafes that we might all eat at. And it's like, you don't judge anybody because it could happen to any of us.
Right. And a lot of those people are working.
If we weren't lucky enough to where, and even if you do buy a home, I had a home in Los Angeles and sold it. So it doesn't, buying a home doesn't guarantee that you're going to be able to keep a home through your whole life or be able to pass it on to your children. To me, this issue is a little frustrating to kind of hear about the surveys and the data because I just feel we're just going in circles. So yeah, that's kind of where
I just want to say, I think that is absolutely the answer. People say affordable housing, if you can't afford to live here, you can't live here. And the answer is always, do you want the market to determine what your community is, or do you want to be thoughtful and intentional about having, the best mix of people for the most vibrant, healthy community that you can have? And it always comes down to that, absolutely. Go ahead.
Hi, my name's Cynthia Angelicola, and I'm the community liaison at Novato High School. I think a little bit of what gets tricky with my position, my job, is that I feel like I'm part of both. Yes, I have to abide by the district's policies, but at the same time, I feel the need to advocate for the families that I work with. And so last week, I had a situation where a single mom was evicted. She got help from the county to pay a few nights at a hotel, but then she ran out of those vouchers. So it was an emergency situation. She has 3 kids, 2 at the elementary level, 1 at the high school level. And the fact that I reached out to student services and we could only offer her a Target gift card for clothes was a shocker to me.
Yeah, that's right.
This is not what she needed at the time. She needed somewhere to stay, and the district could not help. So when I heard Ms. Schwartz mention that we at some point had a homeless education grant, homeless education grant, I'm wondering, why don't we still have that, and what can we do to bring it back?
Right. Happy to answer that. So that's a competitive state grant that actually, it's federal dollars that comes to the state of California, and then counties or school districts can apply for it. And there were many years where County Office of Education received a grant, as did Novato Unified School District and San Rafael City Schools. The money at the federal level became much tighter, and it's a competitive grant. Sometimes you win, sometimes you lose, and a lot of it is based on those numbers and the accuracy of the numbers of children that we would serve. So that's one point that I'd want to say. We will be going for another one, right, Karen? And so trying to make sure that we're getting the best information and that that schools are part of these discussions is really important, that we're working together and that all stakeholders are involved. However, I do want to put a caveat on that. The funding is not for housing. So they're very clear that housing dollars are a county, state, federal line of support.
When you say housing dollars, do you mean things like rental assistance? Okay.
So that is not part of any of those grant funds. What we can help with is when we can help get the child to school, we can help make sure, the little kid has shoes and gets to participate in activities that non-homeless kids, so if you want to be in the band and your parent doesn't have enough money to buy that clarinet, we can help with that. tutoring and actually counseling services were included when we had, when all of our agencies had resources. So I would really encourage you to connect to Karen about potentially being part of the development of the next application. Okay?
Carol, did you want to touch on that? Is that what you raised your hand? No. Okay. Then let's go back.
Okay, thank you. I think there was an earlier question about SB 35 and the state law that recently passed that Suzanne was asking. I was a city planner for decades, and in looking at this new state law, despite what you're reading in the IJ, the letters to the editor, which are full of fear about loss of local control, West Marin or any other jurisdiction in Marin County has nothing to worry about because the streamlining applies to under our current rules, under what the general plan says and what the zoning says. It doesn't change any of that. West Marin can rest assured, okay? So there's no change to local control. There'll be more on that you'll see in the IJ from housing advocates to explain that no fear needed. The second thing I wanted to say is I just want to thank our staff from San Rafael City Schools. We have a lot of community liaisons came, and they're in the front line, that just as the previous question was all about. About a third of our employees live in San Rafael, and that reflects how educators love their community and want to live there. Another third live in Marin, and a third live out of the county. So when it's a stormy day, or when it's the summer, right? Traffic is like, on a stormy day, we have to think about closing the school because you can't run a school when you only have 2 out of 3 adults in the room. And if it's summer, you know that our educators don't live here. We've got a lot of people who live out of the county. School districts, the 18 school districts in Marin are working last year and this year and in the future on building housing on our school sites. So this brings me to my last point, which is political will. The thing is, we have elected people who support more housing in Marin, but they need people to show up at the public hearings and support them in making really hard decisions in the face of opponents. So,
You're here.
I'm going to share with Amy and Meredith information about a new group in Marin called the Housing Crisis Action Group, and this is to provide information to residents throughout Marin about housing advocacy opportunities. So there's a meeting coming up on October 4th, and maybe we can share it with everybody here so you can come and learn more. Thank you.
My name is Liz, and I'm an early childhood mental health consultant with Jewish Family and Children's Services. So I'm working with a lot of families, Latino families predominantly. And I've heard a lot of references to the fact that some of the landlords coming in maybe have a vested interest in, getting the most bang for their buck. And I think that was mentioned by a few people around the room. I was wondering if it makes sense for landlords coming in from outside communities to have some sort of involvement in the community before, being allowed to purchase up land or before being allowed to take over apartments. I don't know how many developers or landlords are in this room right now, but does it make sense to have them attend forums like this or before they can acquire large pieces of land and housing, and to get a sense of what this community is founded on and believes in? And I don't know, I'm obviously very nervous talking about this because I don't want to offend anyone in the room, but I'm a transplant. I'm originally from Half Moon Bay, but I know that the reason I moved here is because I can feel that there's this strong community ethic, and I'd like to maintain that. There's people raising their hand as I'm speaking, so I don't know what to say.
Yeah, go ahead, Debbie.
So I think that requiring them to be good and active community members might be a little bit of an overreach. But there are, we can't even require that of our own neighbors, right? But there are communities that do require more education, right? So Portland, for example, makes all of their landlords go through certain classes, and that is something that we've heard in a lot of our meetings with landlords, that they do feel that there could be a lot of community benefit through a mandatory education program. That could be part of the mandatory mediation program. And Okay, yeah, that could be part of a mandatory mediation program. I'll put that.
Marin?
Sorry, I'm sorry, I will just jump on that.
Okay.
So one concern that we do have is that a lot of our property owners in Marin are increasing in age, as we all are. They are typically invested in their communities. We have a lot of our rental housing stock is of just a few units on a property. What we are seeing is that because of our housing market, there are a lot of folks coming from out of town, and maybe they're wonderful, good people, and maybe they want to be invested in Marin, emotionally as well as financially. But when they come here and they purchase a property, their assessed property value is going to go up. They might need to do some capital improvements, and they're going to have to increase their rents just to make a fair return. Now, it could be possible. So we've been looking at ways to sort of mitigate this impending trend. One thing that we might consider as a county is including some sort of relocation assistance in with a just cause ordinance. There are counties out there that say that if you are asked to leave your rental property because the property is being turned over, the lot is being sold, or some jurisdictions will say that if an owner is moving in, that the landlord, the new landlord or the old landlord, someone would be required to pay you some sort of assistance that would subsidize your security deposit on another place, give you a little bit more financial stability if you find yourself in a predicament where your rent is up, but you haven't quite found another place to live yet. It could subsidize your hotel and rent. So usually those relocation assistance is between a couple $1,000s to maybe 2 or 3 months fair market rent. And that could be one way to sort of soften that experience for renters.
I just want to be cognizant, it's 11:15, and we are scheduled to kind of, if you look at your agenda, to maybe move to a smaller group to talk about next steps, but as long as people are willing to stay here, I mean, unless you all have someplace to go, we're willing to answer questions, and we like this conversation.
So I had two things. I'm Sandra, and I work for the county for Health and Human Services, the Youth and Family Service Team, which is basically child mental health. And I wanted to, I'm sorry, I forgot your name, echo Oshala. In regards to, I attend a lot of meetings, and I'm also a direct service provider. I'm school-based, so I'm also in the trenches. And as a county worker, I do often get asked at meetings and by the schools and by the families. So I heard of a group that's trying to see about funding for data collection, or they want to know about statistics regarding the housing and the families. And the question is often, why not use that money if we didn't data collect for, I don't know, 10 of the programs that we're thinking of data collecting for? All that money could go towards the problem. And I think as a service provider and as a renter here in Marin, it is frustrating when we're at these meetings and people are talking about that's on the agenda, the data collection. We already know it's a problem, so I don't know why we need more data. But the other question I had was, what about rent control in Marin? San Francisco has it and has had it. Why can't we have it?
Good question.
Julia? Okay, and then Julia? Oh, well, no, I think he is. I've met Dave.
Well, actually, it's a continuation of a theme, which is we don't need information, we need motivation. And I think the fact that the county was so reluctant to pass such a simple protection as unjust eviction, to me signals a lack of vision or courage. I'm a landlord. I am living off the fat of the land. Excuse me. I have Prop 13 on my side, so my property taxes don't go up. every penny I pay in interest on my mortgages, I get to deduct. Do you get to deduct your rentals? No. Nope.
It's money down the drain.
Exactly. Out the door, into somebody else's pocket, on which that person gets some deductions. So I'm here to invite. You know, people say notate all the time, and it drives me crazy, and now I've discovered the invitate. That's not so good. But part of the motivation is updating and convening. And on November 9th, we're having the Marin Equity Summit. So please put it on your calendars. You are all invited. There are 11 different interest groups. I invite you to go on the Marin Equity Coalition website to look at them, including housing, education, and health.
Use the mic, Dave.
Pardon?
Use the mic.
The mic. Hello, Mike. And environmental justice, LGBTQ, the key aspects of how people live their lives. I am pleased that the housing emergency has become so strong that we have what used to be the middle class involved in this issue. But the homeless, people of color, the underserved, all that's happened, it's gotten worse. It hasn't suddenly sprung up, it's just gotten worse. So I hope in our solutions we can address those special needs, because to my mind, that's where the suffering is.
Thank you.
The fewest offering. So in any event, Marin Center, $100 a ticket. We've got a panel of great people. We've got George Russell coming in from Berkeley. It'll help us to take action. It's motivated towards that. We'll have information about what all those groups are doing. We're building an infrastructure for equity to move forward across the board. It will include fair housing. It will include housing and health, education. So we need sponsors. All you nonprofits.
We could stop advertising now. I want to go back to the topic. I was going to say something about rent control, and the rent control question person just walked out of the room. Yeah, but she left the room, so I kind of didn't want to respond.
Well, maybe her neighbor can just whisper the
Thank
answer
you,
when
because
she
I have
comes
some,
back.
yeah, go ahead.
So first of all, I would say that, it seems that there's some consensus in this room. Everybody's invested in the idea that understanding that housing is critical, it's necessary, and that we don't have enough of it. That opinion is not perhaps quite as widely held as many folks sitting in here would like to believe. And this question about data collection and should we be spending our money and resources on it, I entirely respect, and it's something that I and other folks on staff consider every single day, right? We're always trying to be as efficient with our limited resources as possible. So whatever program would theoretically be designed, we would certainly be keeping that in mind. However, I do think that data collection is critical because if we can't define what the problem is, and we can't provide information that allows folks with disparate viewpoints to really evaluate the situation for themselves, then it's really difficult for us to sort of get to the next step of problem solving with an invested electorate and an invested group, right? If I can sit on one side of the table and say, affordable housing is critical and we don't have enough of it and it's ruining our community, a person across the table can say, show me how. I think rent increases only went up 6%. You're giving me a token. I think it's really important for us to be able to draft policy and to have constructive conversations. The Board of Supervisors was presented with a proposal the way this works is that staff will come to the Board of Supervisors many times and say, we have all of these ideas for addressing the affordable housing crisis. Please give us direction on which ones to move forward with. It was before my time, but the Board of Supervisors was presented with a proposal for them to consider what we call rent stabilization or rent control at the end of 2015, and it was not selected. The board chose to pursue a voluntary rent guidelines program, which was discussed with a group of landlords and ended up not going anywhere, except feeding into a conversation about mandatory mediation. I would say that mandatory mediation is sort of like the child of the voluntary rent guidelines conversation. MHA might disagree. So right now, there just isn't political will. I would say also that when we're talking about just throwing around money and resources, there are, obviously it costs money to build affordable housing, and we do need to be constructing and preserving more. It also costs a lot of money to buy housing in this market and then preserve it as affordable housing. But there are opportunities to create some sort of housing stability or affordability in this market that aren't centered around purchasing or developing property, and rent stabilization is one of those.
And so is mandatory mediation and just
Right,
cause,
and just
which
cause
is a
for
step
eviction
down
and
that
assisting
road,
with
because
protection, right.
essentially what we heard about considering rent control, at least at the county level, remember, that would only cover unincorporated county land. I mean, you'd have to go after rent control in Santa Fe and Novato and, you know, in Corte Madera, all the other incorporated cities, because they get to control that, right? And basically, the received wisdom was that that's a non-starter. So you got to work with the people you have where they are. And if where they are is being willing to consider just cause eviction, and you can get landlords, especially the mom and pop landlords like Dave Curry, on your side to speak up as landlords and say, we have no problem with just cause eviction because, you know, we do our business correctly and we could follow these rules. And they agreed and they support mandatory mediation. You know, that's a step down that road, but it's a long haul in this county to rent control or rent stabilization. And you can't start there because you're going to lose. If you want to win, you've got to build incrementally and you've got to take the long view. And that means that there's probably not going to be a lot of relief for people like us right now, but we're also fighting for that legacy and we're fighting for the community that we want to see live here. So I just put that out there. It's not that no one thinks rent control is a good idea. It's that the right people don't think rent control is a good idea.
Hi, I'm Julia Kiley-Reish. I'm with the Marin Organizing Committee, and I'm a member of Congregation Kol Shafar. Marin Organizing Committee is made up of I think we're at 18 now, local congregations, churches, synagogues, and nonprofit organizations, and unions. And basically, it's funny because I'm totally an analytical person. I love the data. I don't like to speak to something unless I have done my research and I really have it nailed. But I've been working in this community since 2005 on homelessness, on services for the unhoused, and most recently on renter protections. And basically, I had this reaction when we were talking about data. I love the data, but I had this reaction where I understand it takes a long time to gather the data. And right now, we're at a place where no one's really been doing it. It's even the existing mediation program, the voluntary mediation program that the county has in place, did not collect any data on situations where renters came and complained, but the landlords wouldn't participate. So we have a lot of information to gather in order to have this quantified. But at the same time, at the outside of it, we know that in the Bay Area, we've created 600,000 jobs in the last 10 years, but only 60,000 units of housing. So we know we're behind. And we know Marin is an exaggeration of that. Marin is even further behind. So the way we operate is that we collect stories. And what we've been working in our congregations to gather information, in our organizations to gather information about what people in our congregations are experiencing. But the problem with that is that we don't necessarily have members of our congregations who work here and live outside, because they don't go to church here if they don't live here. They go to church where they live. So what we need We need stories from people, and we need people who are willing to show up with those stories. So when we go to talk to the city of San Rafael, the city of Novato, the city of Larkspur, Green Bay, and on the coast, when we talk to people about rentals and what we need to do to put protections in place for renters now, is we need stories, because that's what influences people. The data is a great thing to have behind you, but the stories is what influences people. So I would really like to hear from any of you that have information and can connect us with people who might have stories from that standpoint, because that's what we find works. Thank you.
Speaking of stories, I just wanted to share one of a colleague who wasn't able to join us today, but he's an employee at the library, and shared with me that in August he was notified his rent was going to be increased $1,000 per month, and that was not workable for him. So he immediately went out to find an alternative solution. He gave notice and had something set up, and it fell through. And he was stuck in the last week of August needing something by September 1st. And I'm not sure what happened. I'm going to be checking back on it. Maybe he's looking for housing today, so he wasn't able to join us. But $1,000 per month, that's...
Yep. Yeah.
Yes.
There are no protections in this county for renters.
Susanna Clark, I'm aide to Supervisor Damon Connolly. I have two questions, one for Lisa Schwartz and one for Debbie. I want to reiterate what Meredith just pointed out, which is the county unincorporated can only regulate what happens in the county unincorporated. We can't control, we can influence what happens in the cities. So the regulations we're looking at would hopefully be model ordinances that hopefully would be adopted by the various cities who have the majority of the rental units, but only with the support of people who go to the city council meetings. Debbie, do you have the figures on how many units are in the multifamily units are in the unincorporated versus in the cities?
Not with me.
But we have that information.
It's census data, certainly.
Okay. And Lisa, on fair housing and what you can do on school campuses, I know fair housing, you can't build housing, I don't think we can build housing designated for certain groups. It has to be open to anyone. Question whether the schools can indeed, because they're doing it on their own campus sites. Can you get around those rules?
So I don't have I can't clearly answer that question, Susanna, but I do know that our superintendent of schools and members of our school boards are actively working on the development of housing on unused school sites or school property. I don't think Mary Jane would go very far down that path or talk about it if it wasn't something that they'd already checked out.
Yeah, that's right.
And it's a very exciting possibility for our county.
Louis, go ahead.
Sure. Louis Jordan, Marin Housing Authority. To the young lady who asked the question about education with landlords, one of the other things that we're doing, and this is through a partnership with the county, is working to educate and give incentives to Section 8 landlords to attract and retain more Section 8 people. That we have a 2-year pilot. The county gave us a little more than $400,000. This is to help with down payment assistance, loss mitigation, rehab, and things of that nature. We're just upon our first year of that program, and we've received, I want to say, 54 new landlords. Now, these are landlords that weren't in our program before, so we're looking to use education and incentives, because as we look at this affordable housing conversation, the landlord population is an extremely significant part. And I agree, I wish more of them were here to talk about those things that we can do collectively. Another thing I wanted to mention is we have a coalition together. It's the Housing Authority, Marin Community Foundation, Community Development Agency representing the county, the city of San Rafael, where we're actively going out trying to acquire property. We're looking to buy property and put, affordability restrictions to say that as we make a purchase of a 3, 4, 5, unit building, these buildings will always be affordable. And so those are some of the things that we're working on to really, build this coalition and this partnership as it relates to affordability in the community.
Yeah, hi. Is this working?
Yeah,
Basically, I'm a concerned citizen. I did formerly work for Community Action Marin for 15 years, and so I'm going to try to put Marin Community Foundation on the spot a little bit. I know they have a representative here.
We can't hear you. Closer to your mouth.
Okay. I'm not sure it's working.
There we go. It's working.
Anyway,
Closer.
okay. I'm sorry. I'm basically a concerned citizen. I worked for Community Action Marin for about 15 years, though. So I have a lot of understanding of the problems of the poor community here in Marin, and I think a lot of Marin residents don't. The good thing about being retired is I'm not worried about offending people here. So I have a question for Marin Community Foundation. And I understand there's a representative here, so I'm going to put you on the spot, if I could, and say I understand, I just heard it mentioned that it is involved in a coalition to look at this problem. I'm wondering why MCF, if it's not, is not strongly supporting rent stabilization or rent control in this county. I think it should show the political courage to do that, and to be really maybe supporting all this data collection. It seems like there's a need for data collection. My understanding is that's the kind of stuff that Marin Community Foundation does. Marin Community Foundation has a lot of money.
Really?
What are you doing for this problem in this county?
Thank you. I'm Alan Burr with Marin Community Foundation, Director of Housing. We do support quite a few activities in housing and homelessness, and we support quite a few of the organizations that are represented here. It's a big problem. It's a multi-year problem. We've, in the past, supported when asked data collection type studies. We've done it numerous times in the past. I assume we will be doing it in the future. I'm having discussions right now about potential work in that direction. So yes, that's on our radar. It's a limited pool of funds. You say it's a lot of money, but we support a lot of different activities, not just housing. I've got a limited budget for housing, and it's a zero-sum game. So it's, as Lewis mentioned, we think the best advertising for housing is having more units available. It's expensive, so we have to have the tough decision of allocating our funds for buying property versus advocacy versus studies versus supporting of the services that are represented here. So it's on our radar to support data collection amongst all those other things that we do support. More specifically, you asked about our support of rent stabilization.
Or other renter protections.
Or when approached for specific advocacy support, we look at that on a case-by-case basis, and we do selectively support. I'm equivocating here. We have to see what the best use of the funds are. If we feel that advocacy is the best use, then that's where we'll go, and we are supporting advocacy that's been mentioned in the past. So indirectly, we give it support because we support advocates that support that. I can't speak specifically about us being more open about support for advertising or whatever, but indirectly, we're supporting advocates that would support that.
If I may jump in?
Just for briefly, because we're going
Briefly,
to wrap up.
sorry for interrupting. At these acquisitions meetings, planning manager Lily Thomas and myself are known for being the people in the room that as soon as a project is pitched, and we are actively vetting and considering projects all the time, that we say, for families? Because almost all of the projects that are pitched are for seniors, and there's this idea that the seniors are the only deserving poor in the county. Seniors are certainly deserving, but I would argue that everyone is also. This is where Lily and I always say, oh, well, you have 11 units that you might consider developing for senior affordable housing. Could we have 11 units for families? Seniors are right now sort of considered the most politically palatable.
They're sexy. Seniors are sexy.
They're the politically they're the easiest group to develop affordable housing for. It is incredibly difficult to develop affordable housing even for seniors. That says something, and I appreciate that we're just trying to get everything that we can. But I would really challenge everyone in this room to join CDA in saying, and what about families? Every time an affordable housing project comes through or is proposed, people will mutter things about traffic. If anybody wants a rebuttal for that, please reach out to me. But I hope that you all will join me in saying that not only do we need affordable housing for our seniors, but also we need affordable housing for our families, for our children.
Absolutely.
Okay, we have time for one more. Yeah, absolutely. That's a big clap. One more question. Go on, Sarah.
This is where my advocacy comes. We need a little bit more education, giving opportunities to speak out and know what you're talking about, raise your voice, etc. So I work in both. I have the opportunity to work in both sizes. I'm like a community liaison when families come to me and I have to refer them. Unfortunately, most of the time I'm acting like a counselor. You know, I'm just hearing because there are not a lot of resources in this county for housing, and it's their reality. But when I try to advocate and say, you can make the change, come to a meeting for Marin organizing community, and we together can try to make the change. It's not many safe spaces. So they don't feel safe. So collecting data for me, I'm a data person, and it's a great opportunity. But if you don't feel safe to give that information, how are we going to collect accurate data? We don't have it. So the Department of Education, the schools, even the clinic and us, we can create those spaces when we can educate the people, when we can give them the opportunity and a safe spot, and train themselves and see we have a voice, we can do it, and we can make the changes.
Thank you, Montserrat. Okay, I'm getting the big wrap-up signal. There's a couple of plugs I'd like to make. One is that for some, one of the issues that's closely connected, at least in the Canal neighborhood, with housing is parking. And tonight, at the Centerville City Council at 5:30 p.m., they are having a study session to consider the report of the consultants that they hired around the parking situation in the Canal, in Spinnaker, and Bay Point. And I think it's really important that the whole community be there represented to hear what's going to be said and what's going to be proposed. There's definitely going to be time for public comment. I'm going to be there. Some other people I know are going to be there. I think it's really important to come out. I've also been told that the Ambassadors of Hope, that's right. That's
Hope and Opportunity.
Hope and Opportunity Youth Team presents a town hall forum on Monday, the 25th, September 6 to 8 p.m. at Dominican University on changing the narrative of preventative approach for homeless youth. Think Different. That's going to be moderated by Anna Pletcher. So this is another opportunity.
And Senator McGuire will be there.
Senator McGuire, I know you had a plug you wanted to make.
Well, that was one of them.
Okay, well,
so
there
you
you go.
took care of that. And Oshala is going to be part of a conversation about race matters this weekend, Saturday, at the County Office of Education. And my hopefulness, I do think race and issues about people who are immigrants is a big part of this conversation. What we don't want to talk about, or what the community doesn't want to talk about. And what I'm hopeful about is, I came here because it was liberal and progressive, and now, 30 years later, we're actually starting to talk about it. So I think that event is really important, the Monday night with Ambassadors of Hope and Opportunity. And then I want to also highlight a workshop that if you go to the County Office of Education's website, you'll see the first week of October is a workshop called Courageous Conversations. So having the ability to engage in those conversations that people have been afraid to have.
Okay.
So please do go to the County Office of Education, look at what the website events are, and in the next few weeks, we're doing quite a bit.
Anything y'all want to plug? Just thought I'd give you an opportunity.
Well, you can, our website is not nearly as nice as everybody else's, but you're welcome to, pardon me, I unmuted myself. You are welcome to get onto our website and subscribe to our newsletters or Gov Delivery blasts. We don't have a weekly thing that we send out, but when we do have a large policy issue coming before the board for their consideration, we do provide public notice. So it's a good way to get in the know and to show up, to participate more actively in the public decision process as it applies to any of these policies that we're bringing in the future. I think probably the sexiest two that are coming up are the just cause for evictions and mandatory mediation. We have nothing scheduled at the time, but if you sign up on our website, you'll know as soon as we do.
And the last thing I'd say is I think that Marin Kids is very interested in this particular issue because clearly housing and children are very, very connected in the health and well-being of all our kids in Marin from 0 to 18. Definitely housing figures into that. So that's something that I'm personally very much interested in working on. And, I have a phone number and an email, and if you've got stories or you want to talk strategy or you have ideas or thinking about what other things we can do, I want to hear about it because I'm really, I grew up here and I really care about this community being the best it can be, and it's not doing that right now, and I'd like to figure out how we can actually change that. So thank you all for coming. This was a great conversation. I'm sorry we don't have fabulous solutions, but I think that we need to keep highlighting it, keep bringing people out of isolation, and keep talking together to figure out what we can do going forward. So thank you very much.